very interesting. Okay, Doug Thamm, Colorado State University, will speak about PD, and he's going to throw in some potential predictive markers for us.
Thanks very much, Carl. I'd like to echo the comments made by the other investigators, just what a privilege it is to be here and talking to this really esteemed audience. It's really a great pleasure. What I'm going to actually do is sort of a series of little clinical vignettes that sort of talk about sponsors that I've worked with, studies that we've done, and again, some of them have not been me, but other great examples from the literature, the questions that have tried to be asked and why they were relevant and sort of to what degree we feel like we were able to answer them, what were some of the roadblocks and hurdles that were hit along the way, to really try and point out, where could these kinds of things be useful, under what circumstances, what kinds of things need to happen first or along the way to move through some of the situations that we may encounter. Let me go back a second. This is my disclosure. I will be talking about a drug, the North American rights to which are currently owned by VetDC. So I did want to point that out. So again, a lot of this has been covered already, so I'm not going to go through a huge number of slides about why the dog could be a good model for certain applications in cancer drug discovery. But one of them that has come up before and that I'll again bring up is the fact of their body size. So this is a detractor in terms of the amount of material that's necessary to perform these studies. It's about 1,000 times more than what would be required for a mouse study. However, it does have some very important ramifications when it comes to things like serial tumor biopsy or serial normal tissue biopsy. Imaging, I think, is going to be talked about more tomorrow, but again, is really critical because, again, what we generally use for our imaging are actually human clinical machines. We're not imaging them with micro-PETs and micro-CTs. So I think the results may be a little bit more one-to-one applicable. Drug delivery and devices is another really interesting one. There are certain things that are very, very, very hard to miniaturize for rodents. And again, so inhalational chemotherapy is something that's been looked at by my colleague David Vail. Isolated perfusion type strategies, again, are things that are very challenging to do in rodents because of their size. And radiation delivery is a really, really key example where, again, dogs with cancer have been used to beta test novel radiation delivery devices. And all of those are situations in which the physical size of the animal really lends itself toward these kinds of studies. And I do want to just digress for a second about the issue of serial biopsy. And again, there's a whole session tomorrow that's going to be sort of about ethics, but one of the things that we talk about quite a bit is it tends to be relatively easy for us to gain compliance for serial biopsy in our animal patients. And you might say, well, the reason that you can gain compliance is because it's impossible for them to put up a fight. You have to, and that's true. But again, the owners are the ones who have to talk into this. And I think the major difference doesn't have to do with a lack of free will or anything else like that, but we're so used to doing so many of our procedures with chemical restraint, whether it's taking radiographs or doing an ultrasound or doing the typical clinical things that would normally be done in an awake person. It's routine for us to do those with a little bit of sedation for safety reasons. And that does make it much easier for us to, along at the same time, actually obtain tumor tissue in a way that's very, very safe and very, very ethical as well. And again, that's a type of information that is, again, incredibly challenging to actually get in human studies. And that's where I think there are some real pluses to what we can bring to the table in these very early preclinical studies. And again, one is, of course, validation of target modulation, which is kind of the low-hanging fruit. So in addition to standard PK measurements, we certainly want to know that the new drug that we're using is capable of hitting its intended target. But I think more important than that, when we're thinking about the translation to human, is if they're not going to be able to do these same types of invasive validations in humans, can we validate non-invasive measures of drug exposure that may be useful in subsequent human studies, whether there's something that could be measured in peripheral blood, whether it's something that could be measured via imaging, et cetera. So more invasive validation of potential non-invasive biomarkers that could be used in human studies, I think, is a very important thing that we may be able to bring to the table. Dr. Khanna talked earlier about validation of tumor-specific targeted delivery of therapeutics, and I will use the same example that he brought up earlier. And then, as Carl mentioned, also investigations of potential predictive biomarkers and ways that we may be able to sort of validate those preclinically as well. So one of the examples I'll talk about first is an example of a collaboration that we had with a company called Pharmacyclics that makes a small molecule inhibitor of a kinase called BTK, or Bruton tyrosine kinase. And recently it became evident that there's a subset of B-cell neoplasms in humans that appear to be reliant on continued B-cell receptor signaling, even when they're in a very advanced stage. And as a result, strategies that may be capable of inhibiting signaling through this pathway downstream of the B-cell receptor may actually be quite efficacious for at least certain subsets of human lymphomas. And although there are a number of different drugs that have been looked at to actually inhibit this signaling cascade, again, the one that Pharmacyclics was interested in is an inhibitor of a kinase called BTK. A few years ago, we actually were able to answer some questions for Pharmacyclics that we thought were important in moving their drug forward. One of them was a very simple question in that, again, sustained B-cell receptor signaling appears to be important for certain subsets of lymphoma, but that paradigm is not adequately represented in mouse models generally. There are some genetically engineered mouse models where it has been, but the typical xenografts that you would think to explore really don't adequately recapitulate that. So a spontaneous model where there's a higher likelihood that the microenvironment would be conserved and result in sustained B-cell receptor signaling was thought to be very important for demonstration of efficacy. But the other part, which was very important, gets back to my idea or the comment that I made about validation of potential surrogate biomarkers for taking into the human clinic. And that was a very, very important part of what we designed this study for, which was to validate actually a fluorescent probe receptor occupancy study assay to be potentially used in peripheral blood in humans. And again, one of the goals of this study was to determine if we saw changes in probe receptor occupancy in the peripheral blood, was that similarly reflected in the tumor tissue? So could the company feel comfortably looking in the peripheral blood and making assumptions about what was going on in the tumor? Again, could we evaluate that in our dog patients? And the way the assay works is, again, this is a fluorescent probe that looks a lot like the drug. When it's bound, in the absence of the drug, it sticks, and you can actually pull it down using a fluorescent Western technique. In the presence of the drug, again, blockage of this probe or binding of this probe is blocked, and as a result, you'll see a disappearance of that fluorescent signal. And again, we were able to look in a series of paired pre- and post-tumor biopsies, as well as pre- and post-PBMC biopsies at 2 different doses, actually, and demonstrate there did appear to be very good correlation between what was observed in the peripheral blood and what was observed in the tumor tissue, suggesting that moving forward, this may have been a very good surrogate for them to take forward into the human clinic, which is what, in fact, they did. Along the way, again, we were also able to generate data regarding efficacy in this population of dogs. And there's actually 2 things to look at here. One is that there are actually 2 very different doses noted, used. One was a dose of about 20 milligrams per kilo, and then another was a dose that was almost a log less than that. And this is, again, really sort of helping to refine that distinction between maximum tolerated dose and biologically effective dose. So again, when we got through with this initial cohort of 4 dogs dosed at 20, and we're actually able to take a look at PD and PK, it looked very strongly that a lower dose of medication would certainly be capable of hitting target blood levels that were appropriate, as well as modulating target and, again, causing that good probe receptor occupancy as well. So that's why, again, a similar cohort of patients was enrolled at a much lower dose. And again, really encouragingly, we saw activity at both dose cohorts, both at this high dose and at this low dose. And again, I would editorialize and say that when we're talking about biomarkers here, I would say that, you know, tumor regression is probably your best pharmacodynamic marker for evidence of that you're getting good blood levels. So, you know, this was incredibly exciting work, and I do feel like it really did help to accelerate the pathway towards utilizing this in humans moving forward. And primarily, it's something that's a bit intangible, I think was really engendering enthusiasm among potential study sites on the human side. When they were able to show this data, they said, look, this worked in real tumors. I think it really sort of put it up the list of priorities for several of the human investigators that were going to be involved in the first in-human studies. And again, this is a drug that's now been demonstrated to have efficacy in a number of different human B-cell malignancies and actually is approved. Couple of things that we had to think about actually as we were moving through this study. So the first and simplest one to answer is there even a canine BTK homologue? And as a result, is this a drug that's going to work? So the answer to that was yes. Do canine B-cell lymphomas express BTK? Is that target conserved? The answer there was yes as well. And then again, is BTK active in canine B-cell lymphoma and inhibitable with this particular small molecule? Again, in vitro, the answer there was also yes. And these are all kind of check boxes that we had to fill out before we were able to really feel comfortable moving forward. One of the things that was challenging, however, was one of the other assays that actually we were helping with was actually looking at BTK phosphorylation in the presence and absence of this drug. And again, the antibody that the company was utilizing did not cross-react with dog. So we found several total BTK antibodies that worked just fine, but the phospho-BTK antibody that the company was planning to use was not cross-reactive. And again, this is something that the veterinarians in the audience can really sympathize with. We do have to do a lot of legwork looking at validation of cross-reactive antibodies. So at the protein level, it can be very challenging. Again, John talked about this earlier, so I don't want to spend a lot of time on it, but to say that this is another kind of biomarker or pharmacodynamic endpoint that we can look at. So in this case, the tumor-restricted or tumor-localized delivery of a therapeutic. So we know that TNF is actually a very potent cytokine that has really quite remarkable anti-tumor activities, but its use is limited by very severe systemic toxicity. So ways to circumvent that through, again, targeted gene delivery, for example, isolated lymphofusion, et cetera, are ways that can really amplify the effects of TNF while minimizing the toxicity. And again, this was a targeted gene delivery mechanism using an adeno-associated virus that's targeted to an integrin that's present on the surface of rapidly dividing endothelium called alpha V beta 3. And again, the goal of this study was twofold. As John mentioned, one was to make sure that the toxicity profile was appropriate in tumor-bearing animals. And the second was actually to look at localized gene delivery. Was it appropriate? Was it tumor-specific, as it should have been? And again, John showed this already. But both at the level of protein and at the level of nucleic acid, RNA, the study was able to demonstrate quite nicely that there was tumor-selective delivery of this adeno-associated virus to tumor vasculature very specifically, not in the pretreatment samples and not in corresponding normal tissue. And this actually correlated with elevation in TNF-alpha gene expression. Very specifically in the tumor tissue, but not in the post-treatment normal tissue. Along with this, again, there was an opportunity to look at least one necropsy sample from a dog that unfortunately died as a result of its disease, not as a result of the therapy, and demonstrate similarly in a wide variety of organs that there was very tumor-specific delivery, but real an absence of expression of this vector in any other organ that was evaluated. This is something that, again, Dr. Gustafson mentioned earlier, and Dr. Toomas will talk more about tomorrow, so I don't want to spend a lot of time on it. But this is actually a prodrug, a nucleotide analog prodrug that we had a chance to work on with Gilead Sciences several years ago. Again, sort of in preparation for clinical development. And Dan showed some very nice data earlier looking at some PK aspects of the work that was done to validate appropriate biotransformation of this compound in the target tissues, disappearance in serum, et cetera. But one of the sort of nice sidebars to this was actually a subset of dogs that were actually imaged by Jessica Lawrence at the University of Wisconsin when David Vail was there, using fluorothymidine PET-CT. And again, this is the idea of using potentially the opportunities in serial biopsy of the dogs to validate an imaging-based endpoint for use in potential human studies. So I'm going to go ahead and skip this. So this is just a little eye candy. So this is actually a pre-treatment scan here. And again, this is fluorothymidine. So we're looking at areas where there is very rapid tumor proliferation that are evidenced in this pre-treatment scan. So multiple lymph node beds, giant spleen in this case. And then this is a post-treatment scan, which is essentially a normal scan, a cold scan. So in addition to the clinical measurements that were obtained, again, we had the opportunity in a subset of patients to actually obtain imaging-based endpoints that help to validate our clinical assessments. And again, sort of this touchy-feely thing that I keep harping on, I think, at the level of the sponsor, really helped to engender enthusiasm for continuing to move this program forward. They say a picture is worth 1,000 words. I think that really did help. But again, the other component of this was the ability to sort of invasively validate this non-invasive imaging-based endpoint through serial biopsy and actually measure of tumor cell proliferation utilizing immunohistochemistry. Again, to give us all the feeling that what we were observing here via imaging was adequately reflected in the tumor tissue via more conventional histologic means. The other example that I'll bring up, and I hope I'm not stealing Cheryl's thunder here, is again the very, very elegant work that Cheryl performed about 10 or 15 or 37 years ago. Back at University of California, Davis, using this really intriguing molecule, SU-11654, which is now known as Palladia. And as Dan mentioned, it's almost identical to Sutent. And the path that was taken forward was really to take a second to lead strategy with a molecule that's almost identical, but not exactly identical to the company's lead compound, and actually do some proof of concept studies in dogs that will get information about safety, tolerability, PK, and target modulation in vivo. And again, just a tiny bit of background that most of you are very familiar with. The KIT protein, KIT is a receptor tyrosine kinase that's expressed on both normal and malignant mast cells. And a fair number, probably about a third of canine mast cell tumors are actually characterized by an activating mutation that renders it constitutively active. And again, important from a translational perspective, I think all the MDs in the audience know that people don't get mast cell tumors. I mean, they do get some other mast cell syndromes that have varying degrees of similarity. But the type of mutation and the resulting activation of KIT that's present in canine mast cell tumors is very, very similar to what's seen in human gastrointestinal stromal tumors. So here's a really great example where potentially the target and the modulation of that target trumps the histotype of the tumor. So again, this is just some data again from the phase 1 study that Cheryl performed. Again, really tumor reduction is probably the ultimate biomarker. And in this particular study, about half of the dogs with mast cell tumor responded. And responses were actually much more common in dogs with activating mutations. The thing that really set this above, really all the other studies that had been done at the time was, again, the opportunity to really validate target inhibition. And she did this actually through a series of pre and post tumor biopsies that took place both before and 8 hours after the very first dose of Toceranib that was given, looking at alterations in KIT phosphorylation. And again, quite intriguingly, a large number of dogs actually demonstrated very nice modulation of KIT phosphorylation following that very first dose of Toceranib. Interestingly, 3 dogs with mutations actually started out with high KIT and went down, but 2 dogs without mutations also didn't. And again, we could sort of get into why that is, but an interesting finding nonetheless. The other thing that's quite fascinating about this when we're starting to talk about predictive biomarkers is actually these 5 dogs who all demonstrated significant downregulation of KIT phosphorylation were responders. These 2 dogs that did not demonstrate significant reduction in KIT phosphorylation were non-responders. Again, very, very small n, but very encouraging clinical evidence to suggest that maybe both the presence and absence of an activating mutation, which was fairly intuitive, and what happens a very short period of time after the very first dose could be incredibly informative biomarkers for what to expect in the future. The other thing that I'll say is, again, this is an example where there was an a priori hypothesis about what might dictate whether a dog was going to respond or not. So again, it's kind of looking for your car keys again under the streetlights. These kinds of studies are certainly very amenable to more agnostic omics-based approaches looking for predictors of response, or again, surrogates for future response in pre and post settings. So whether it's proteomics-based, whether it's expression profiling-based, et cetera, taking into the caveats that we're dealing with relatively small n's, these exploratory studies, again, are things that are quite easy, I think, to get accomplished in dogs, partially because of the ease with which we're capable of obtaining this tumor tissue. Finally, I do want to mention that, again, we've taken this data that Cheryl generated and actually used it for a bit of a personalized medicine study that's actually funded by the American Kennel Club and is just completed enrollment. So this was a Bayesian adaptive randomized study actually comparing a targeted kinase inhibitor to a traditional cytotoxic, utilizing, again, or stratifying based on the presence or absence of a mutation and the presence or absence of different or altered distribution of the KIT protein within the mast cell tumor cells. So again, something that again has limited implications for the human side, with the exception of a really cool study design that we've been able to undertake with the help of a very talented biostatistician from University of Wisconsin named Jens Eickhoff. And with that, again, I'd like to thank all the sponsors whose data I was able to present here, as well as the Center for Cancer Research, again, and the COTC for funding all the studies that we've been doing through the COTC. And again, I'll just quickly acknowledge the AKC Canine Health Foundation as well for the funding for the Bayesian study that I just mentioned. And thanks very much.